I'm Thomas Baldrick at ASH 2014. We're happy to have with us Dr. Gerds from the Cleveland Clinic talking about doctor-patient communication and MDS. Thanks for coming by.
Thanks for having me.
In your opinion, what are the primary barriers to effective patient communication with these patients?
Thank you. That's a very interesting question. There could be a lot of barriers, and we tried to address some of those barriers with our particular survey study that we completed. And actually, I'd like to say that this is the third iteration of this particular effort through the Aplastic Anemia and MDS International Foundation. With the first survey, we really found that there was some misconceptions on how patients and doctors viewed MDS as whether or not it was a cancer, in fact. And we've tried to develop tools subsequently around that. With the second survey, we found that there are some differences between how doctors and patients feel their treatment has been going. Is it beneficial to them? Do they have side effects? So we've, again, tried to develop materials to the Aplastic Anemia MDS International Foundation to address some of these issues to help improve communication. With the third iteration of this survey, which is the present abstract at this ASH meeting, we look to see how patients move through treatment, and at the time treatment is discontinued, is there still good or bad or inadequate patient-doctor communication? May that influence how patients decide to stay on or go off of treatments?
So what have you found with this most recent data?
So this most recent data has been very interesting. We got responses from over 300 patients and over 50 doctors. And what we found that is at the time of diagnosis, when a doctor first sits down with an MDS patient and says, you have MDS, and explains to the patient what's going on, there's a lot of concordance between what doctors say they're providing and what patients say they're receiving. So over 80% of doctors report educating their patients at the time of diagnosis. And over 80% of patients report that the doctor did sit down with them and tell them what is MDS and what are we going to do about it. There were some interesting little caveats with that, though. Although well over 70% of doctors reported discussing risk and prognosis, but either by the IPSS or IPSSR scoring, only about 50% of patients could actually report their score, or at least have an approximation of their score. Additionally, over 80% of doctors reported that they told their patient MDS is a cancer, where only less than 20% of patients reported that MDS was told that, or they were told that MDS is a cancer. So there is some differences there.
Where do you see this disconnect and how do you fix it?
You know, we see this disconnect, quite frankly, not only MDS, but I think across a number of diseases. These diseases are so rare that I think a lot of doctors don't have as much experience with them. Although I do have to say that almost 40% of the doctors that completed this survey do see on average more than 5 patients per year with MDS. But I think educating the physicians is part of the solution. I think the other part of the solution is educating patients. These patients are very active in online, social media, and through foundations such as the Aplastic Anemia MDS International Foundation.
So what do you see as a good step in improvement?
Yeah. So I think out of this particular project, the main point, the driving home point, and where we can improve is actually at the end of treatment. So what we saw is even though there's a lot of doctor-patient communication at the time of diagnosis, at the time of treatment progression or at disease progression or treatment discontinuation, there was a big difference. So the vast majority of doctors said, I educate my patients at the time of disease progression or treatment discontinuation, where less than 20% of patients said they received education at that time point. And ultimately, what we found was that doctors and patients have a different opinion on why the treatment was stopped. Doctors tend to say, well, the treatment was too toxic, or there were side effects, or maybe the patient's disease progressed. Where patients typically report that the treatment stopped working for them. So they're similar, but there's some subtle differences there, and maybe that might lead to changes in how patients and doctors view continuation of treatment, or perhaps going on to a subsequent treatment. And this may play out in clinical trials, as we'll see in the late-breaking abstract session on Monday, where the largest randomized controlled trial in MDS was completed, 3 arms, azacitidine alone versus azacitidine plus lenalidomide versus azacitidine and vernistat. And we saw that in the combination therapies, treatments were often peeled back earlier than expected, and perhaps affected the overall results of those trials. So maybe if we were able to improve doctor-patient communication, both on the physician side and the patient side, that we could have better treatment persistence over time. And I think the third critical component of this that wasn't addressed in this abstract is actually the nurses and other support staff in the care of these patients. And quite frankly, nurses take care of these patients just as much, if not more, than doctors do. And in fact, a lot of the survey effort on a larger scale was targeted at nurses and how nurses communicate with patients. And that data will be presented at the upcoming ONS meeting in the spring.
Well, it's good work you're doing, and we hope maybe this little communication between us, you can share it with the doctors and patients in the study, and maybe this will help too.
Absolutely.
Thank you very much.
Thank you very much.